As we have been reporting this morning, healthcare systems in the Western Cape are under severe pressure with increased COVID-19 infections, hospitalisations, deaths as well across the country, but more specifically talking about the Western Cape province this morning. According to the Health Department's COVID-19 statistics, the province currently has a cumulative total of more than 180,000 COVID-19 cases. With more than 34,000 active cases, the province's hospitals in the Cape Metro have reportedly reached capacity with oxygen usage at an all-time high. This as holidaymakers are expected to head to Cape Town or have already headed to Cape Town and other tourist hotspots in the province. To talk further with us, we are joined by Premier Alan Winde. Premier, good to have you. Thanks so much for joining us.
Good morning. Thank you. Good to be with you.
Premier, let's begin by talking about this new variant of the coronavirus that's in the province. We've reported that 2,500 beds are filled. Private hospitals are at full capacity or near full capacity. Netcare Mediclinic in the province cancelling or postponing non-emergency surgeries. Those are the details we have. Perhaps you can give us more updates. How are the hospitals looking?
So absolutely, both public and private hospitals are at capacity. And of course, you said 2,500 patients in our hospitals at the moment across both public and private. The problem is that the more COVID-19 patients you get, the more or the tougher decisions our health system has to make. So we have to say to people, sorry, this surgery is not important and we will exit you from the system. We have to make those decisions to free up extra beds. When we got news last Friday night on the science around this new strain, what we did is the epidemiologists and professionals in our province went and re-looked at our modelling because the one thing that we don't want to do is run out of beds. And so we re-looked at the modelling. We know that we need to, what we projected, we need to now find another 500 beds. That means more triage into the system, but it also means what are the extra beds we can bring online. And of course, it's not necessarily only the bed itself. The most important ingredient here is the frontline worker, the nurse, the doctor, those health workers. They are the most important. So the bed is easy. It's the workforce that's been under strain. They've been working now for 9 months, and obviously did have a little bit of a reprieve when it flattened, but really for 9 months, our frontline have been on duty 24/7. And right now, when your hospital is at capacity, or even some of our hospitals are more than 100%, so that shows you we've squeezed in extra beds, we've squeezed in more than is the standard number, and that means even those frontline staff are put under even more pressure. So that's really where it sits. And my plea is, please bear in mind that frontline workers. Everything we do, we must do to save the stress on those frontline workers. So when you decide to go out with some friends and you're not wearing your mask, you're putting actually our nurses at risk. And you've really got to rethink that. It is keep to small bubbles, keep it small, and keep it outdoors, and keep it close with your family units in your hand sanitizing masks. We all know what to do.
We've just do it. That's the reality. Premier, let's talk a little bit to the healthcare workers, because we do know, as you said, this has been going on for months now, and they've been tirelessly working. But besides that, there's also the issue of a shortage of healthcare workers. And I was sort of wondering, if we're running out of beds, why are we not using the infrastructure for, I think you had built it at the Cape Town International Convention Centre. However, it's about the staff shortages. Perhaps you want to elaborate on staff shortages and also how many healthcare workers you've actually lost across the Western Cape to this.
Yeah, unfortunately, just in the last 2 weeks, 5 healthcare workers have passed on because of the virus, and we're seeing more and more the numbers growing of healthcare workers that are also testing positive themselves because of the viral load, because they are at risk working on the front lines. And, obviously we've got to protect them as best as we can. That's why we need to make those decisions. We did put the field hospital in place, the CTICC, but we decommissioned that when we flattened the curve. But what we have been doing ever since then is making sure that we're getting extra beds around the province. First of all, in our existing hospital systems, so you would have seen across the province, storerooms are now wards, extra storage space now has been converted. So we've got 690 extra beds that are seen as field hospital beds across the province, and existing beds in our existing hospitals we've increased across the board. We still have our biggest field hospital is the 330-bed R300 or Brackengate Hospital, which we then transfer the name Hospital of Hope. We also have at Lentegeur Hospital in Mitchells Plain a number of wards that we've opened up. We are also then making those health decisions, decanting certain hospital wards that might be focused on a specific, for example, TB or something like that. Those hospitals are being decanted so that we're making them available for the healthcare that is needed for COVID-19. So these are the difficult decisions, and every single day the system is having to make those decisions to create those extra spaces. And the research on the new virus now over the weekend shows us that we need to find another 500 beds. That's our peak is coming in 2 weeks' time. And so, we've still got some work to do.
We've just received a message here, and I just want to read it to you because it seems that there's some issues with some of the hospitals. This is somebody writing to us from Westlake, Cape Town. I'm not sure if they want their names to be mentioned, saying, I tested for COVID-19 at Victoria Hospital, was almost turned away and told that I must go back to my primary healthcare facility or have a private doctor's letter, and I watch people being turned away and not being helped. This is why we as the so-called poor communities don't go for testing, because we are humiliated at hospitals. By the way, I am still waiting for my results a week later. That is from a viewer that's writing to us now. What's your response, Premier?
Okay, first of all, please, that viewer must please just send me a direct message. You can send it to premier.winde@westerncape.gov.za. Just Google, or just send it on a social media platform. You'll find my name anywhere. I'll check on that. That cannot be a week later and not get your results. That just cannot be. Obviously, what I do want to say is that if you have symptoms, the ideal is to stay at home. We are triaging and we are making decisions on testing, as we are having to do now across the country. We're having to now only test people at risk and people over 55, and people. And we also test obviously people who are sick in our hospitals. I had a meeting yesterday with our health team and also Minister Dr. Zweli Mkhize yesterday, because we also are getting more and more of the rapid tests. We need to get that going a lot quicker as the numbers pick up. But my message as well is, if you're feeling symptoms, please stay at home, isolate yourself. If you feel like you're getting sicker, you must call the number, the hotline number, or before you just present, because we can hear that at our clinics and at our hospitals, people are just presenting, and if they're just coming because they think they might want to check, that really does clog the system. We need to make sure that we've got space for those that are sick. We've got oxygen. I know that our oxygen usage is also way up. We're now sitting at 58% use of our oxygen. We measure it every single day. Some of our health professionals are coming out with really clever ideas on how we get more and more people that need it onto the oxygen systems so that we can look after you. But also we need people to play their part. Those people that are sick, we need to make sure that we're giving you the best care that we can give you. If you don't need to clog it up, then please, we need you to stay at home as well.
I mean, I know, Premier, there's also been talk of people, doctors. I mean, we read open letters that doctors have been writing, and some situations of people talking within the hospitals. And, it happens that a lot of them do come out of the Western Cape, saying that they had to choose between who gets to go into a bed, who gets to use ICU, who gets to go onto a ventilator, and who gets to take oxygen. Is that the situation you're at right now? And what are the criteria for those that are actually chosen, whether they can live or not?
Okay, so at the moment, those choices, the choices that we're making at the moment in our hospital system is how to free up the beds. Obviously, if you come there, we will help you. So, for example, I think last weekend we had in Mitchells Plain Hospital, we really did hit a sort of solid wall of people coming to look for help. And as you're discharging people out of the system, you're also getting people coming in. So our head of health, Dr. Kluti, was telling me one of the doctors very quickly rigged up oxygen systems so that even people in the waiting room were receiving oxygen while they were waiting for the bed. And then the decision that you're talking about, those tough decisions that our doctors are making, are saying, well, what ailment have you got? And in actual fact, we're going to have to actually ask you to discharge because we are going to be bringing in a COVID-19 patient. And COVID-19 patients also, you can't just put them in any ward. So you have to then also make those decisions to say a whole ward is now going to switch from general healthcare to COVID-19 healthcare. So then you would have to make sure you've exited everybody else in that ward, either to go home or to go to another facility. And these are the tough choices. And then there's another layer of tough choices that come along, and that's the trauma layer. So it's the alcohol abuse that fuels trauma. It's the motor vehicle accidents. It's the people that are not adhering to the rules on the road, and they add to the stress on the system. So again, we're saying to people, please don't abuse alcohol. Please make sure that when you're driving on our roads, you are doing so safely. Don't take chances, because those road accidents, they take a lot more of our manpower in the hospital system. And what they also do is they take those ICU beds, which are critical. And so we have to make space for them. And those are decisions that you have to make as well. So every single time we don't wear our mask, we're putting pressure on those healthcare workers to make those critical decisions.
Which is vital at this point, because there are just those certain regulations that we can put into place, like wearing masks, sanitizing and everything. Some people feeling that they're getting mixed messages, though, from the likes of the DA. I mean, let's just talk to, perhaps we know that it is a battle to keep the economy going as well, which is the reality. But court battles in the Garden Route District Municipality, obviously we saw the outcome of that one. These are hotspots. So, we've got beach closures in George, Plet, Knysna, Mossel Bay, and also just talking to now the earlier curfews. We're allowed to go onto the beaches now between, I think, 6 and 7. That was also a request. There's the party revelers, people just posting photographs of themselves out having the time of their lives without wearing masks, and many saying, well, it's okay because we can go out there and do what we like because the DA are fighting this, so obviously it doesn't really matter. Do you feel that perhaps you are giving mixed messages?
Okay, so I can assure you that on the Garden Route, we would much prefer people in the open outdoors than in the malls. We need people to understand that and I think the best way, we finished off our Digicon yesterday with getting people to understand that we live in little bubbles. So your family unit is a bubble. If that bubble goes to the beach and stays separate from other people, that's a good thing. We're saying keep small and keep outdoors. We know that indoors you are 18 times more likely or 18 times more susceptible to infection than outdoors. So whether it's a beach or a park, we're saying that, and I'm not saying that about big congregations at the beaches. I'm saying to be able to be outdoors is much safer than being indoors. And what didn't make sense for me was, especially on the Garden Route, in our small towns, forcing people not to be out in the open. And then what do people do? They go and congest in the coffee shops, they go and congest in the shopping centres. And that really doesn't help us at all. The science tells us the opposite. What we're advocating right now across this province is keep it small and keep it outdoors. If you've got another family unit, another bubble joining you this festive season, make sure it's not more than another bubble. Make sure it's just the 2 family units you're getting together for the festive season. You know each other, and you know that there's a minimal risk, but make sure that you're still following the rules. And if you do it outside, it's way better than doing it inside.
Okay.
It's about common sense at the end of the day, and we've got to make sure that we get that right.
And I mean, Premier, you've been through COVID yourself. You know exactly the repercussions of having COVID. Premier, in 30 seconds, there are so many people that are coming down for their holidays, returning to the province, especially now as Christmas comes, New Year's Eve is happening. Do you have extra security personnel available to ensure that people abide by these rules that are in place?
Yes, absolutely. And we have been now for the last 3 weeks upping the law enforcement, doing raids on those places that are not adhering to the rules. We're meeting with the faith-based organizations tonight again to say in the festivity time when we're having our church services over Christmas, please, we need to bring them right down in size. Any place where we're congregating, rather have it outdoors and make sure that those numbers are small. And the law enforcement side is playing their part to make sure that those who are not sticking to the rules, there will be consequences. But at the end of the day, we need to be human beings here. Yeah. And we need to think about the pressure that our frontline workers are under, and it is our responsibility to do the right thing.
All right. Premier, thanks very, very much for talking to us. Western Cape Premier Alan Winde talking about how the province is dealing with coronavirus second wave and this new variant, which is putting the province under immense pressure.